complications post-COVID and their preventive measures. So he is at present with the Yashoda Hospitals, and he is an expert in CABG. So without much delay, I hand over to Dr. Ayush Goel to please carry on.
Many thanks, madam. A very good afternoon to you all. Am I audible to everyone?
Yes, yes.
And you can see my slides as well?
We can see your face at present. The slides are not visible.
The slides is not visible.
It was visible before, but...
Is it visible now?
Yes, yes.
All right. So, good afternoon once again, and I hope everybody is safe and healthy. And we wish and we pray that everybody of us stays healthy as well as safe. So let us go about this small talk by a method of a story. So imagine a young chap in his 40s who is recovering from his COVID illness, and he is not feeling well about himself. Sometimes he has some chest discomfort, sometimes he's out of his breath, sometimes some heartburns. He's not okay. What does he do? He probably calls up a friend who has some friend in a medical school, or a family friend who is a doctor, and the doctor assures him that you will be fine. In most probability, he will be fine. But he is not settled. He is not settled with this fact that he will be fine. So he Googles himself. As he Googles himself, he discovers that he is in trouble. The Google says you have got an MI, you have got a heart attack. What does he do? He gets panic. So this whole talk for today is about this scenario where a person from COVID either recovered or is ill, and how does he go about treating himself or his heart problems. So the steps of this talk would be, say, first let us talk about how COVID affects your heart. Then we can understand who all are at risk or who are at more risk of developing these heart problems. And we identify what are those symptoms or what are those problems which can be picked up, and we identify them. And then how can you help yourself in either treating or preventing them. And lastly, we talk a bit about how we can help you in getting yourself treated. So this COVID is a very complex illness. This is a very complex illness which affects a lot of our organs. This cardiac system or heart is just not the heart. It involves, this whole system involves heart, the lung, and all the blood vessels which are connected to it. This COVID, by certain pathological mechanism, causes inflammation, and this inflammation has a tendency of making your blood clot in these vessels. So if you have it in your heart, you get a heart attack. If you have it in your legs start paining. If you have it in your veins swell up and you get a DVT. No, furthermore, it also damages the strength of your heart. This phenomenon is called myocarditis in our technical language. It weakens your heart to pump. So you might have a feeling that your heart is not pumping well, you are out of your breath all the time. Also, this clotting can happen in your lungs, and lungs and hearts are connected in series. If these two organs are connected in series, anything which hampers the lungs will always and always hamper your heart. So all this conglomeration of clotting, inflammation, weakness of the heart causes this whole cardiovascular system to be at very high risk because of this COVID illness. To move ahead, we must understand that which people are more at risk. Mind you, these are not only the people who are more at risk of getting infected by COVID, but also developing the complications because of this COVID. So number one, any person who already has a pre-existing heart disease. He's suffering from some previous heart disease. He has had some stenting done to him. He has had some operation done to him. He's an extremely high risk patient. Secondly, all patients who are having any other comorbid disease. So let us say the patient has diabetes mellitus, he's got an asthma, or he's got some treated cancer. If he's on extremes of age, he's an elderly man, he's probably not eating well, he's malnourished, or he's eating too much and he's obese, his lipids are going haywire. All these people, or he's suffering from some kidney disease, all these people are at very, very high risk of getting complicated because of COVID. Furthermore, any patient who has had severe COVID illness, whose COVID was not mild like a flu, whose COVID had troubled him because of his lung condition, because of his any other illness, the COVID was severe. These people are at extremely high risk of cardiac disease. It must be noted and it must be understood that this COVID is not a one-time disease. It affects for a very long time your various organs, and there are certain reports from Europe and China which says that COVID illness after 1 year is resulting in an illness in heart, which is specific because of COVID, not seen before. So it is just not a benign flu which came and which went. We must be looking after these small symptoms which are very, very pertinent to identify whether you are in trouble or not. So how do you identify your problem? In our medical languages, we
उसने कुछ क्या कर दिया इसने ये नहीं हमें रोकेंगे यार
Sir, you are muted as of now. Try, sir.
Sir, please unmute yourself, sir.
Dr. Sab, you're muted. Please unmute yourself.
are you able to listen to me?
Yes, yes.
First
Now
part of the
you're
talk. Hello?
now you're audible.
So you were not able to hear the first part of the slides? Hello?
No.
Rest of the
No.
please mute yourself.
All right. I'll go back. So we were not able to listen to any of these slides. All right.
The first slide was okay, Dr. Sab. The second one.
Did you hear the story of the person?
Yes.
You heard that story?
Yeah.
Yes,
Yes.
sir.
Okay. All right. So did you hear the various
Third slide.
third slide?
Yes. Up
At
to
this
this
point?
it was okay. Now
Yes.
from this slide it was muted.
All right.
Exactly.
So in our medical language, we talk about any symptom or any group of symptom as either acute or chronic. So acute means that the presentation is sudden and needs an immediate attention, while chronic is something which is over a duration of period or duration of time which this manifests. So acute presentation of a heart illness is a heart attack. The patient feels a very sharp shooting pain in the chest, which radiates to his jaw, maybe to his arm. While a chronic symptom, this chronic symptom will be like a heart failure. He will present with breathlessness, fatigability, maybe swelling in his legs. So the most important aspect of discovering your disease is you have to identify these symptoms. So if we talk about any chest pain, any chest discomfort, any irregular heartbeat, any breathlessness or out of breath or short of breath, or maybe you are feeling giddy, you are feeling dizziness, or you are started developing your leg swellings, we are all looking at problems to the heart. In colloquial words, it is, I would say that if any problem which comes on exertion and which goes away on rest is heart problem until it has been proven otherwise. So this is the golden rule. Any problem which comes on exertion or walking or maybe doing some activity and which goes away on resting is a heart problem until we prove it otherwise. Two other things which I would like to emphasize here is every time we have a focus on the heart and we forget our blood vessels. So the two blood vessels, arteries and veins, are very important. Arteries get clogged up, you get pain in your legs. Vein gets clogged up, you get DVT, swelling in your legs. Both of them are manifestation of the same pathology, that is clotting, which is caused by COVID. So how can you help yourself? This is the most important thing, is how can you help yourself? So the first and foremost thing is you must have the will to help yourself. You must be wanting to help yourself. If you don't want to help yourself, then nobody else can help you. And you must feel the need that you have to be helped. And this is done by identifying those symptoms we just spoke about. First and foremost, you must identify that, okay, I am having these symptoms and these symptoms are not going away. So you need help. This help can come from yourself first. So the first thing which you must do is you must monitor. All of you are technical people. आप लोग बहुत ही समझदार लोग हैं और गैजेट से वेल इक्विप्ड है. तो सबसे पहली चीज जो आपको करनी है वो है you have to monitor yourself. So 5 things you have to monitor. Number 1, your heart rate. It is very simple. You can count your heart rate. Your digital watches will tell you. Your saturation probes will tell you. Certain mobiles will tell you. First is heart rate. The second is you must have a BP apparatus at your home. If you are in your 40s and you have parents at your home, every household must have a blood pressure apparatus. Digital blood pressure apparatus are very common, and you must monitor your blood pressure, especially when you are recovering back from COVID illness. So you have your heart rate monitored, you have your blood pressure monitored. The third thing you should monitor is your saturation. This is very simple. You have saturation probes. Everybody in COVID is well aware. Put it on your finger and you see your saturation. The fourth thing is a little difficult, is your respiratory rate. Sometimes people are not able to count their respiration rate and you need help from somebody. But a simple test like how many counting can you do in a single breath will be able to tell us how is your breathing pattern. In a single breath, how many numbers can you count? Hindi mein count karo, English mein count karo. And fifth is your symptom. What are you suffering from? Say, for that example of our story, this person was suffering from shortness of breath. He was feeling chest pain. So you document shortness of breath, chest pain, and then on date and time you write your heart rate, your BP, your respiratory rate or your single breath count, and your saturation. So you document this. This is very important. You just cannot tell any colleague, any doctor, anything that मुझे ठीक नहीं लग रहा था, मैंने कुछ नहीं किया, मैंने आपको फोन कर लिया. This is not expected of so educated people like you. So if you come back to us with a chart which says this time I was feeling this were my parameters, we will be able to help you better. The second important part of this is how can you keep yourself healthy? This is the crux of this talk, that how can you keep yourself healthy? Because if we can prevent something, it is the best aspect of our medical services. So this I will give you a mantra which my father has taught me. He is my teacher also. And we will go by A, B, C, D, E, F, G, H, I. Correct? So A stands for alcohol. Nobody would say that alcohol is healthy for your life. Nobody will also say that alcohol is absolutely bad for your life. I am that kind of doctor who would say you must keep control or keep moderation in your drinks. Alcohol hampers our immune system. It disturbs our lifestyles. So it changes our circadian rhythm. So we must control our drinking and alcohol. So if you ask me, doctor, how much can I drink? What is safe? There is no safe limit. It is absolutely individualized. So you must not binge drink, number 1, and you must not take more than 2 drinks. And this activity of drinking should not be more than twice a week. So you must drink in moderation. The second alphabet B stands for BMI. So BMI is a group of assessment. Is a mathematical statistical tool which assesses your height and weight. So if you are maintaining your weight according to your height, you are bound to stay healthy. So you must look after your weight. You must check your weight. The third C stands for cigarette. So this is an absolute no. There should be no tobacco in your life. Cigarette smoking, tobacco chewing, all hampers your life and your heart and your body's immune system in a very, very bad way. So there is no cigarette or tobacco in your life. The alphabet D stands for diet. So you must take a very balanced and nutritious diet. Your carbohydrates should be low. Your oil or fat should be less. You must take vegetable oils. These are better and preferable. But overall, there should be less sugar, less carbohydrates, less fat to have a and lot of minerals, salts, and fruits and vegetables, which must be taken roughage. So you have a balanced diet. The fifth alphabet E stands for exercise. Everybody must, or each one of us must walk every day. You might do some hardcore work in your gyms, but walking is mandatory. A 30-minute walk, maybe with your spouse, will just help your heart and your health and your family in a very, very long way. So everybody must walk. The sixth alphabet F stands for two things. It stands for family and it stands for focus. So you must spend time with your family. There are a lot of things which go inside our body which get detoxified when you're talking around with your family or your loved ones. And the focus stands that you must meditate. It is not a very long yoga or concentration. No, 5 minutes of focus on your breath will help you in a very long way. The G alphabet stands for Gheri Saans. You must deep breathe. 5 minutes of you exercise on your breathing in form of maybe pranayam or just taking in deep breath and blowing it out as if you are blowing a candle will help your lungs and your heart to recover as well as to gain strength. It is like exercising how we exercise our muscles. It is like exercising your heart, and this will support your heart in a long way. Alphabet H stands for again two things. It stands for hydration. That means you must drink fluid enough that you stay hydrated throughout the day, and you must laugh. Hasna jaruri hai. So hydration or hasna. Okay? And the last I stands for you must in the sun. You must have some time spent in the sun so that your body holistically recovers and feels healthy about itself. So I would repeat them quickly. A for no alcohol, B for maintaining a good BMI, C for no cigarettes, D for a very good diet, E for exercise, F for focus and concentration, maybe meditation and spending time with family, G for Gehri Saans, H for Hasna and hydration, and I for spending time in the sun. If you are helping yourself, then you might not need us, and we will be, to be honest, we will be happy to keep you healthy at your homes. But if you are having trouble, we are there to help you. And how can we help you? We can help you in various forms, as in we can give you preventive health checkups. We can help you diagnose if there is a real ailment. If you are diagnosed, then we can definitely offer you definitive treatment in form of medical therapy, in form of surgical therapy. And in any way, as I told, if there is an emergency or an acute symptom, we are available round the clock to look after your any acute illness. Thank you very much.
Thank you, Dr. Sir. Now let me put the first question, that is, how often should a person get screened after COVID?
Yeah.
If you could please speak on that subject.
So if a person has got only, we are talking about screening for cardiac diseases.
Yes, yes.
So if a person has no risk factor and has had only mild COVID, he might not come to us for any checkup. He must just keep monitoring the parameters which I have discussed, and he does not need to come up for any evaluation per se. But if the person has got moderate to severe COVID and has any of the risk factors, then once he's up and about his COVID, he should get a baseline check, and then once a month after that baseline check. If these two baseline checks are okay, means the baseline check at say just after recovering from COVID and 1 month later on, if these two are okay, then he's not at a risk of developing a cardiac disease. But if any of these tests show us any abnormality, we will then keep him up on follow-up as per the severity of that disease.
Thank you. There's Mr. Sandipan who wants to know which oil should we take.
So generally vegetable oils are preferred oils, and the conventional knowledge of our old time kitchen would be groundnut oil. But because these vegetable oils are always safer, in the market you will get safflower or sunflower oil. But I would suggest, if the taste is not an hamper, then any vegetable oil. And personally speaking, what oil do I take at home? I take groundnut oil.
Mr. Pankaj Singh Rawat has asked, can you kindly repeat the ABC indicative abbreviation?
Yeah, absolutely. Absolutely. So A stands for alcohol, which is a no or limited alcohol. B stands for BMI, that is maintaining a healthy weight. C stands for cigarette, or no smoking or no tobacco in all forms. D stands for diet, that is a balanced diet or balanced nutritional with low carbohydrate and low fat diet. E stands for exercising, at least 30 minutes walk. F stands for focus, that is meditation, and family, spend some time with family. G stands for gehri saans, you must breathe 5 minutes at least with deep breaths. H stands for hasna, that is you must laugh, and you must also get hydrated, you must drink well. I stands for in the sun, you must spend some time in the sun to acquire some vitamin D and daylight.
Mr. Nitin Mehra, last year in April, he got infected. He recovered at home. At that time, and even now, my sleep is getting disturbed and I'm not able to, I'm not sleep whole night without feeling anything. Maximum for 2 days. It happens even now.
All right. So when you are not able to sleep, are you feeling restless, or are you feeling discomfort? Or do you have to take heavy breathing in that? Or if you have any of the risk factors which we mentioned, say you are an obese person, you have some diabetes, you have some kidney issues, you have some family history, then you must visit us once so that we do your analysis in form of heart echocardiography and analyze whether you are really suffering from a disease, or the disease or the sleep cycle is altered because of another factor. If you have a disease, we will have to look into it, what exactly it is.
Mr. Prasad, yes.
So it is good that you are trying to identify what any symptom do you have. This is I'm very happy to note that this talk has at least made you realize that there is a symptom which is going on. I'm extremely happy about it.
Mr. Prasad wants to know, what is the ideal resting heart rate? Is it a concern if the resting heart rate is more than 90?
So in our biological books, we would say anything from 60 to 100 is normal. Generally, a person would have, in a healthy adult male, would be around 70 to 80. 90 is not worrisome, but persistently staying up at say high 90s, 95, 96 is not healthy at all. Primarily, you must look at your hemoglobin level and maybe your hydration level to initially look where your heart rate is more. Sometimes you are not drinking well water, your body thinks that let us compensate by increasing the heart rate. Sometimes you are anemic, your HB is low and the body increases your heart rate. If these are the not basic factors, then we have to look into it by your ECG examination.
Now we have Mr. Satyanarayana, who wants to know whether there is a link between gastric problems and heart attacks.
Absolutely, absolutely. So heart is the organ which is supplying blood to every part of your body: brain, eyes, kidney, liver, lung, and even your gastrointestinal tract. So if you have a gastric problem which is not being detected or being getting treated by the gastroenterologist, he has done your endoscopies, he has seen improved your diet, he has made you gluten free, and he has looked into IBS and everything, and you are not getting over it, you might be having an underlying heart disease, or you might be having a blocked vessel to your intestine. So I cannot on record say that abdomen problem or gastro problem not because of heart. Absolutely no. You might have, but initial investigations might involve gastroenterologist who might rule out his basic diseases. If those are not solving you, then it might have an underlying heart problem. Yes.
Mr. Gavendra wants to know that after recovering from mild COVID, how many weeks later should he resume his exercises, regular exercise?
So take it in a stride that you had COVID and do not rush into your gymming. At least 6 weeks after your COVID, you must get back to basic aerobic exercises, and it would take a 3 months time to get back to hit your gym. And you must note that your muscles generally are a little sore after a break, and they are weak as well. So do not exert yourself to get back into your normal routine or normal exercise capacity. Go slow on yourself. Go slow on yourself.
Now, Mr. Verma wants to know how to reduce triglycerides.
How to reduce triglycerides? So there is a desi way and there is a medical way. So desi way is आप exercise करो और आप अखरोट खाओ. These two are very helpful things to get your triglycerides back on track. The medical way is you have medicines which can get back your cholesterol levels and control them. And the best part is initially you start taking your medicines to get them back on track, and then slowly wean off those medicines so that you're off medicines and on exercise and diet, so that the harm which it can cause is little averted.
Now we have Mr. Srinivas who wants to know what is the effect of snoring on heart.
Yes. So snoring indicates that some people would call it an obstructive sleep apnea, or it indicates that your lungs are exerting a little bit more to get itself some air. When the lung is doing that, the as I told you, heart and lung are on series. Heart to lung and then back lung to heart. This is how the blood circulation flows. So if your lung is exerting too much to get in air, your heart also starts exerting too much to push in more blood. So the right-sided heart, which is pushing in blood into the lung, I'm sorry, right-sided heart, which is pushing in blood into the lung, starts exerting more. As a result, the right-sided pressure starts rising. And when this right-sided pressure starts rising, then it has a tendency to get thickened. And once it starts getting thickened, the right-sided heart starts failing. So you have all the symptoms of fatigability. You have symptoms of maybe some swelling in your leg. You have symptoms of not feeling okay about yourself. The right-sided heart will give you vague symptoms of failure. So it definitely increases the work the heart has to do to pump in blood to the lungs. Yes. So you must lose weight. You must have a healthy lifestyle. You must lose weight. You must sleep well. You must ensure that your spouse is telling you turn around, do not snore, and you must get evaluated by a pulmonologist for obstructive sleep apnea. Yes.
Mr. Neeraj Kumar wants to know the difference between heart attack and cardiac arrest and how to differentiate it.
Okay, so suppose you are working on a machine and the machine gives you an alarm, battery is low, and the second machine says battery not enough and shuts down. So the first part is an heart attack. That is, your heart has given you the indication that blood is not reaching it completely as per its requirement, and it gives you an indication by pain. And a cardiac arrest means the heart has stopped itself from working because of lot of reasons. It could be because of heart attack. It could be because of not receiving adequate oxygen. So heart attack is a manifestation of decreased blood supply to heart, while cardiac arrest means the heart has stopped functioning.
Very simply and very nicely explained, Dr. Goyal. Now I invite Dr. Sangeeta Rizwood, our corporate CMO, to say a few words.
Sure.
Dr. Sangeeta, please.
Good evening. Good evening, Dr. Ayush.
Good evening.
थैंक यू, आपने जो अपना कीमती समय निकाल के हम लोग एनटीपीसी के लोगों के लिए जो पोस्ट कोविड टाइम के जो कार्डियक सिम्टम्स है कॉमन जो है उसके लिए बहुत नाइसली एक्सप्लेन किया है। और जो कई सिम्टम्स आजकल जो पेशेंट जनरली पैल्पिटेशन कुछ एंजाइटी के कारण भी होता है, लोग समझते हैं कि गैस्ट्राइटिस के चलते हैं, पर जो आपने बताया है इसके लिए लोग अपने लिए कंसर्न रखेंगे और छोटे सिम्टम्स को भी निगलेक्ट नहीं करेंगे। कुछ लोग अभी कोविड टाइम में विजिट करने से भी अवॉइड कर रहे थे, अभी कि हॉस्पिटल नहीं जाना है, इसके चलते उनकी जो मेन प्रॉब्लम था वो बड़ा हुआ रूप ले लेता था। बिल्कुल। थैंक यू अगेन। और ऑडियंस के लिए भी मैं थैंक यू दें, क्योंकि वो लोग भी अभी पूरा अपना टाइम देके उन्होंने सिंसियरली सुना भी है और ये अपने लिए भी देखेंगे और अपना हार्ट ठीक रखने के लिए जैसे डाइट, जैसे आपने बताया, एक्सरसाइज बताया, नॉर्मल स्ट्रेस कम रखना है, नॉर्मल डाइट, नॉर्मल स्लीप, थोड़ा धूप, वेंटिलेशन प्रॉपर रहे और हार्ट को स्वस्थ रखना है। और कुछ भी हार्ट के लिए जरा भी लगे तो कंसल्ट कर लेना है। बिल्कुल, एब्सोल्युटली, आपने एकदम मुद्दे का बात पकड़ लिया। आई एम सो हैप्पी अबाउट इट। थैंक यू डॉक्टर, और थैंक यू पीएमआई टीम का जिन्होंने बहुत अच्छे से अरेंज किया। थैंक यू श्रावणी।
Thank you.
Excuse me.
Yes.
Yes.
I have a small doubt. Can I ask, please?
Yes.
Sure. Please.
Yes.
Assume a case of mild COVID where the infection did not go below the URT and there are no comorbidities at all.
Below the?
Now, it's a very mild infection and that thing is over.
Okay.
And done, the virus will remain in the lymph, in the system, right? In the lymph system and the circulation system. Now, there have been a bundle of research papers on use of small dosage of anticoagulants.
Absolutely.
What do you suggest, doctor? Do you suggest one should take some anticoagulant for some time?
Look, if
the D-dimer is okay?
To make how to, no? Aspirin?
Exactly. So there is a difference between anticoagulation and antiplatelet. So the medicine which are say aspirin or clopidogrel, these are antiplatelet drugs, while there is a group of medicines like rivaroxaban or Eliquis. These are anticoagulation drugs. So any patient who has had severe disease or who is at high risk. So if we go back to our slides, you will realize that any patient who has a previous heart disease, any patient who is a diabetic, kidney disease, who is asthmatic, or who has cancer disease, who is malnourished, who is extreme of age, or who is dehydrated for a long time, these people have a higher tendency of getting the blood clotted. So only if you have had severe disease, you are above your 60s or 65 years of age, and you have any of these comorbids, a short period of 3-month anticoagulation might be advised. But other than that, anticoagulation for everyone is not a rule. Absolutely no. You might continue to take a antiplatelet which you are taking from before, but anticoagulation is superior or is a higher level up than antiplatelet. So anticoagulation for everybody, no.
Thank you for your time, doctor.
Yeah.
Thank you so much, Dr. Goyal. It was a pleasure having you on board.
Thank you, Dr. Banerjee.
We keep hoping to meet you more and more to give such talks.
Sure.
Thank you, everyone, for being with us today.
Thank you, everyone. Thank you very much. Thank you.